Third generation, stress management. This is where I think most employers really need to give a lot more emphasis than they have. DuPont did a study with the University of Pennsylvania and some other researchers a few years ago, and they had no intent in driving the conclusion, but they looked at what are the highest healthcare costs to the employer's bottom line. Looking at healthcare, and also they couldn't pick out all the corporate metrics that they would like, but I think they used unscheduled sick days. They had a measurement for what some would call presenteeism or impaired presenteeism, young job, but you don't have to think about it, and maybe disability. A couple of the metrics. What do you think was the number one healthcare cost by far? I've given you enough leads and hints already. There you go. By far. Number two, anyone want to guess? Musculoskeletal. Which a lot of it is due to stress. So I don't think they had all the stress and depression there. So really important to look at your consumerism around stress management in your organization. Here's some of the numbers generically for stress management and the corporate impact. Stress accounts for 21.5% of healthcare costs, 40% of the reasons employees leave a company, 50% of that presenteeism or impaired presenteeism, some use to more accurately reflect that you're there but you're impaired, 33% of all disabilities, and 50% of the reason that employees take unscheduled sick days. Here's a lot of the demand and the affected body systems. Now, it's not a one-to-one correlation. If the doctor pushes me on some, I'll say you're right, because I don't know. He's the doctor, I'm not. But this is what I've gotten from other doctors, psychiatrists, psychologists trying to put together some of the sources of the pressures that occur and some of the major body systems that are affected by stress. This is, I think, the second most important chart other than that crystal ball grid that we showed earlier. This is the key to the third generation and stress management. On the left-hand side, we have the medical intensity. How intense is that level of depression or mental health condition? All the way from frustration, anxiety, low stress, all the way down to anger, attention deficit, high stress, schizophrenia, the more sophisticated types of, and down to violence and suicide. If that's the medical intensity, here's the direct mental health cost from low to high. But there's two other impacts. Comorbid conditions, where the depression and your medical condition actually line up. Like I said, if somebody has got even a low level of stress, they're going to deal with it. Tobacco use, sleeplessness, colds, flus are more common. Blood pressure goes up. All the way down here, if you've got depression, musculoskeletal, hypertension. Everybody that I've come across that's deeply involved in this issue, and I have been for 25 years, either has had a family member or a personal experience with depression. I have. I can tell you when I had depression, I got all sorts of tests for digestive disorders, stress tests. A company paid thousands of dollars, but nobody was interested in looking at the underlying causes. So you're paying for that in your employee costs. You're paying for all this stuff over here, but you're not treating here. You can't treat a diabetic who's not compliant with their medication regimen if they're depressed. They're not just being difficult patients. They're depressed. It is a unique illness, in my opinion, and is the only illness that I can think of where you push away the caregivers. Every other illness, you draw them to you. You want the oncologist. You want the cardiologist. You want them to help you. But with mental illness, you push those folks away as well as your family members. And so it's really difficult to get them to be compliant. So it's really important to recognize that it has all these interactions, and there is a relationship to the healthcare costs and outcomes that you're generating in your healthcare plan if you're not dealing with these. The second big area, which may be even bigger, I don't have a number on each of these levels of cost impact, but on the far right-hand side, these are what I call the indirect corporate costs. If you got somebody who's sleepless, they're depressed, anxious, doesn't sound like a great diagnosis they have, it's not significant. Well, every day I got some, I get up on the wrong side of the bed. But you have increased errors. You have loss of being a good team member. That's going to cost your organization. You go down even further to depression, anger, attention deficit, more unscheduled sick days, poor morale, conflict relationships, lost productivity. That's costing you your bottom line. Go all the way down. You ever been through an organization where somebody's been divorced, you've been divorced yourself? You're not very productive. You can't think about anything. What's your future like? What's going to happen to your kids? What in the world went wrong? I don't understand. You can't think while you're on the job. So you need to be able to deal with these in your overall program. Go down to all the way to the bottom down here. Disaster recovery. You know, think about that classic example of the post office worker that gets upset, comes in and shoots up everybody. We've seen too many things like that in schools these days even. What if you got somebody who's suicidal and prone to violence because they haven't been treated, and yet they have access to some of your IT systems? They can bring down your whole company, your whole marketing system, your whole database. Pretty high cost. So again, I think this is one of the most important charts underneath the overall grid and the impact. And I can tell you there's going to be a bunch of questions off of this chart.